Urging people tonight to stop using an anti-parasite drug meant mainly for animals to treat and prevent COVID. Daniel Hamburg talked with an infectious disease doctor who says this is happening in our area and it is dangerous. Daniel's in the newsroom tonight. Hey, Daniel.
Hey, Alicia, I want to tell you that Ivermectin is the drug that we're talking about. It's not authorized or approved by the FDA for treatment of COVID-19, but some are buying it off the shelves, dangerously dosing themselves.
As COVID cases continue to rise, many people are taking treatments into their own hands. That includes the drug Ivermectin.
When we use Ivermectin under a physician's guidance, under a physician's dosing, it can be a very safe drug because we give you the correct amount. We don't give you the amount that's normally intended for a horse.
UPMC infectious disease specialist Dr. John Goldman has used the drug to treat infections including parasites, worms, and scabies.
But I'm also giving the right dose. I'm also not giving it for COVID. And in fact, if you take it for COVID, you're risking using an ineffective treatment with side effects.
New data shows a dramatic increase in prescriptions being dispensed for Ivermectin. That medicine is meant for humans, but some are buying it on store shelves meant for animals.
The assumption is people are obtaining it so that they can use it either for treatment of COVID or in case they get COVID.
This week, the CDC said there's been a rise in calls to poison control centers from people reporting overdoses and more people experiencing adverse effects from Ivermectin. Goldman says the team at UPMC reviewed all the studies on the drug.
We came to the same conclusion that the FDA, the Department of Health, and the NIH all came to, which is that the drug does not work. The risks outweigh the benefits.
And Goldman says if you do develop COVID symptoms, contact a doctor. Don't try to treat them on your own. In the newsroom, Daniel Hamburg, ABC 27 News.
Good information.